Thank you. All right, we are now live, and I am so grateful that you all have joined in. Listen, I want you to share this link and this Facebook page with everyone that you know on this evening. We have a phenomenal woman. I have heard her speak and share regarding all the concerns regarding the coronavirus, and I want everyone to be wise. This actually is the beginning of our wisdom session that we will be running the entire month of July. And this evening, speaking about the health concerns and specifically with the coronavirus. I want you to prepare yourselves. I want you to be attentive. And as you are attentive, if you have questions, I want you to feel free to type them in to the link. And Pastor Michelle and I will be on board where we will be able to relay the questions at the end to this wonderful woman, Dr. Aboelata. I believe I have to pronounce it right. Pastor Michelle shared a Facebook page or a YouTube page with me, and I listened to several of her messages, and I was enlightened, and I thought she would be the perfect person to bring before you tonight. So I want to give her time to share whatever stats or whatever she has on the coronavirus. I want to tell you a little bit about her, though. This is something that's really impressed me since I've listened to the YouTube videos, is that she works in Oakland. I think you grew up in Oakland as well. And you all know that I'm an Oakland native. And I just want to read a little bit about Dr. Noha Aboelata. She's the CEO and founder of Roots Community Health Center, and she has devoted her career to eliminating health disparities and improving the health of marginalized communities. Through Roots, founded in East Oakland, she has pioneered the delivery of culturally responsive whole health and championed the integration of physical and behavioral health care, workforce enterprises, health navigation, and mobile medical services. I love that. She's addressed the needs of over 10,000 members. She oversees Roots, that has grown from a two-person volunteer facility to a multi-campus, multi-county nonprofit with over 175 staff. I am really impressed, and I appreciate Dr. Aboelata for being with us tonight. She says prior to Roots, she's an Oakland native, served in the senior executive roles in Tiburcio Vasquez Health Center. And she is a Native American Health Center and the Native American Health Center in Oakland. I want us to she's received her doctorate from Howard University. So I want you all to receive tonight Dr. Noha Aboelata. Share this link because she has information everyone that you know should know and that they should hear. And I want to just give you this scripture in Psalm 112 and verse number 5. And it says, a good man shows favor and lends, and he will guide his affairs with discretion because he is knowledgeable. When we have knowledge, we will know how to guide our affairs. And through these wisdom sessions, we're giving you knowledge, we're giving you wisdom so that you can make the right choices and the right decisions. So without further ado, I want you all to receive Dr. Noha Aboelata. God bless you, Dr. Aboelata, and thank you.
Thank you so much. Thank you so much for having me this evening. It's really a pleasure to be here. And thank you for that kind introduction. I'll add a couple of things about what Roots has been up to in the pandemic, because as you can imagine, we mobilized very quickly. We're right there in East Oakland, where we knew that our community was going to be hit hardest by COVID. And unfortunately, we were right. The area that we're in there in East Oakland has had a disproportionate burden of COVID cases, COVID deaths, and now we're also seeing very low vaccination rates. So we are still in it. We were the first walk-up site in the Bay Area. We started, it's hard to believe now, in April of 2020, providing walk-up testing. Our organization has done over 38,000 COVID tests. And early on, we saw that there was just a lot of confusion, I think, and almost at times not enough communication, at times too much and too much conflicting and just a lot of confusion. Unfortunately, that has kind of remained the case, I think, through today. And that's why we started the health briefings, which we started also about a year ago. Every Tuesday morning on Facebook Live and on YouTube. And it's just 15 minutes of an update of what's going on and any pertinent topics that have been emerging. And so that's something that we've been doing. I remember when we started, we thought, oh, we probably only need to do this for maybe 5 or 6 months. I think we all had high hopes, but it's been quite the roller coaster, as we all know. And so I think we're at a point now where, we're still in a global pandemic. But we are in a better situation now in the sense of, cases have come down. And most of that is because of vaccination rates. And so that's a great thing. However, we are still a ways away from any kind of community immunity or herd immunity, as they say. And so we still remain vulnerable as a society, as a globe. And we've been going through so much as a world, in this past year and a half. And so I love that this is the Wisdom series, because this really has required us all to sharpen all of our tools, really, and to be able to do a real kind of risk and benefit analysis of all of our actions, because our actions do always have consequences. But as it relates to this invisible and very tricky virus, it has been a step ahead of us this whole time. And I have to tell you that it still is in a number of ways. And so while I think, there's reason to feel optimistic at this time because cases have come down, we can't let our guard down. And I'll tell you why, a few things. So one thing is, cases are down, like I mentioned, across the state and across the country, but they're upticking right now. And in the Bay Area, in California, we're starting to see a little uptick of cases, which was anticipated. So I want everyone to understand that this was not something that surprised anybody, because people who make decisions, they're looking at numbers, they're doing their analyses. And if there's room in the hospitals, and if they can sort of do the balancing act that they have to do, and I'm glad that's not my job to have to figure out how to balance all the things that they have to balance. But there was an expectation that anytime you open things up, you will have more mixing. And anytime you have more mixing, you will have more cases. And when you have more cases, you have more hospitalizations. And when you have more hospitalizations, you have more deaths. So with the reopening and the relaxation of all of the mask mandates and so forth on June 15th, we have seen the uptick. We're starting to see that now. And so we're seeing increased cases. We're seeing a little bit of increased hospitalizations. And we're also seeing the disparities that we have been seeing throughout the pandemic, but they're beginning to widen. And the reason being is because the communities that have been hit with the hardest with cases and with deaths are also the same communities with the lowest vaccination rates. So this is the part that concerns me the most. And as you mentioned in my introduction, a lot of the focus of my work has been eliminating disparities. And unfortunately, the disparities are kind of getting worse from here because of what I mentioned. And so I think we have sort of two major concerns on our minds. And I think the first is at the individual level is the remaining unvaccinated. So we're concerned about those who are unvaccinated. That includes everybody who is under 12 years old, right? Because they're not eligible yet. And then anyone who has not yet gotten vaccinated. So all of those people are still vulnerable, and in some ways more vulnerable now than before. And why? Because, well, a couple of reasons why. One, because we have variants that are much more contagious than the original type that we were dealing with. The other reason is because we're doing less protective measures now, right? You can't rely on other people all wearing masks and being distanced. Everybody's dropping all of that. And you can't tell by looking at someone who's vaccinated, who's not, who might have COVID, who might not. So now those who are unvaccinated no longer have the benefit of knowing that there are these, public health measures being implemented around them. So even though there's that savings grace that we have overall lower case rates, it only takes one exposure for you to get infected. And so we still have concerns that case rates can go up in the fall or in the winter. So that still remains to be seen. But we also have a concern that for those who are unvaccinated and kind of pockets of unvaccinated. So if you have a workplace, if you have a household, if you have, any place where people are congregating together and a number of them are unvaccinated, that's where we're concerned that we will have pockets, we will have outbreaks, and those will spread even faster than they did with the wild type, because the variants that we are dealing with are more contagious. And everyone's heard about the Delta variant that is fast taking over. And so we're already, the last I saw was about a third of the sequence cases in California already are Delta. So, and it is the largest one, right now, out of all the other ones have smaller percentages. So I think a lot of people are predicting that's going to become the dominant strain worldwide in short order here. And so we know that it's more contagious. Not sure yet if it's more deadly. There are some kind of like conflicting reports. There are some that are showing increased hospitalization with the Delta strain. So that's very concerning. So concern number one is our remaining unvaccinated in this new world of no real restrictions on folks. Second is really on a population level. So can we get to that community immunity? So we're not there yet. And I know that it's variable. The last I saw for San Joaquin County was about 50% when you take the whole county being fully vaccinated. So higher in Alameda County at about 80%. So I think, there's some variability with the different counties, but none of that is enough to kind of get us where we need to go with community immunity. And with more contagious and different strains, the level we need to get to keeps getting a little higher. So we're dealing with a little bit of a moving target with that. And so it makes it, and with the replication happening at the rate it's happening in other parts of the world, there is always a chance for new mutations. So we've got the Delta. Now there's reports of the Lambda. The Lambda is causing, it appears, these very high death rates in Peru. They've now identified it in the UK. The UK is doing a lot of sequencing. They're doing a very good job on sequencing, so they know what variants there are. The United States is still sequencing a tiny percentage. Last I checked, it was less than 2% of our sequences. So of our positives are being sequenced. And so it means that we don't always know, right away when these things have descended upon us. But it only takes one plane ride to import a variant over here, and then it can spread, and just like with Delta, and then it can become the dominant. And so we're still chasing COVID in that sense. And what we worry about is that if it keeps mutating and mutating and mutating, eventually it may mutate to one that gets around our vaccine. We're not there yet. And I think that is a blessing. And so that what we do have now is working, and it still remains kind of the only way we get out of this pandemic is the vaccine. And I really wish there had been another way. I sometimes share that this time last year, I was still saying, well, maybe not this time last year, maybe about April, I was saying, well, maybe it'll fizzle out like, SARS and MERS, and, it'll just burn itself out. Well, clearly that's not happening. This thing has got momentum. It is outpacing us. It's staying a step ahead of us. And so we have to be wise. We really do have to be smart. It's not time to rip off the mask. It's time to be cautious. It's also time, I think, this is my opinion now, is that it is also showing regard and respect for others who you don't know their situation. Maybe they can't get the vaccine right now because of a medical condition. And by taking your mask off, you're not protecting them, right? So you're saying, I like it better without my mask, but whatever's going on with everybody else. So to me, it is also a way to say, I care about other people. And I also care about the other people I live with. And some of us live in households that have a mixed status of vaccinated and unvaccinated. If you have children at home that are unvaccinated, or others at home that are unvaccinated, or maybe someone with a compromised immune system, we don't know how well they responded to the vaccine. All of those things are these variables that we just don't know yet. And we want to protect not only ourselves and not only our loved ones, but the community in general. And so I think we're just still not there yet. I understand we're all ready to try to go back to some semblance of normal. But what we don't want is to act too prematurely and then find that there are outbreaks and there are increases in cases, or that there are yet new variants that we need to be even more concerned about than what we've already been dealing with this entire time. And so I definitely can go on about this different things that we're hearing from folks in the community around the vaccine or questions that people have, but I don't know if now might be a good time for me to pause and see if you have any questions you'd like to pose for me. I'm happy to keep going. I know we hear a lot of concerns about the vaccine itself, so I'm happy to get into that, but maybe y'all pause right there with the status update and see where you'd like me to go next.
All right, I need to unmute myself. I think that this is probably a good point. We do have some questions that have already come through. And there's one that regarding the Delta virus, and someone is concerned as to whether or not the Delta virus is covered by the vaccine. So if they take the vaccine and the Delta variant is here, will I get it? Can I transmit it to my mother, to my grandchildren? What do I do? How do we ease their concerns?
Yeah, it's a great question. And, right now, thankfully, our vaccines are covering the Delta variant. That may not be true in other parts of the world that have different vaccines than we do, but we are fortunate that so far, with all three of the vaccines, it is preventing death and hospitalization. Now, we know that no vaccine is 100%. So we knew that from the beginning with this one, even before the Delta variant, right? We said these vaccines are around in that 95%. Which is still 5% chance you could catch it, right? But people who catch it were getting a much milder case. The same is true with Delta, that it's preventing the hospitalization and death, but you could still get a mild case. However, it's not that 95%. So we're looking more like 88, 90%, which is still great. It's great even compared to a lot of other vaccines. And I'll just remind all of us is that in order for it to have passed through the vaccination trials and become something to consider, the threshold was 50%. Okay. So when we got those 95%, we were all just amazed that it was that effective. But we've got a little spoiled by that, I think, too, thinking, if somebody still got it. Well, yes, we know that someone can still get it. And with it circulating the way it is and hundreds of millions of people having gotten the vaccine, of course, some people will get it. So maybe instead of 5%, maybe it is a little bit higher, like 10%. Okay. However, it's still protecting from hospitalization and death. Now, the question, though, the way the question was asked, I wasn't sure if those grandmothers, mothers, and other people, are they vaccinated too? Because I think the real concern is that even though you might not get sick or die with it, you have that 10% chance you could be a carrier. Will you spread it to other people who are unvaccinated? If the other people are vaccinated, we're much less concerned, because two vaccinated people, they both have so much protection that we're really not as concerned about that. What we're concerned about is if you're going around mom or grandma, they're not vaccinated, could you give it to them? And we know that people who are vaccinated are not very effective at transmitting it. So meaning they tend to not have symptoms. So they're not coughing, they're not spreading it about to the extent of someone who's unvaccinated. So the chances of you spreading it are still much lower. However, if those people are unvaccinated, I'm concerned for them. And so we're still wanting them to get vaccinated. And my recommendation, and this is a conservative recommendation, so I always have to kind of give that caveat, because not all of us in the field are as conservative as each other. So we all, and like I said, wisdom, right? And like you said, wisdom. And so thinking about your particular situation. So if you're someone who lives in a household with people who are unvaccinated, that you're concerned about, your behavior when you're out in public is probably going to need to look different. So you're going to be more likely to want to wear your mask so that you prevent yourself from even being a carrier of it. Now, if you never go around anybody who's unvaccinated without your mask on, maybe this is going to be less of a concern for you because you're protected and you're not exposing anyone else. But if you are going to be unmasked around unvaccinated people or people with compromised immune systems, then you, in my opinion, should continue to behave as though you could be a carrier, and therefore you protect yourself from catching COVID. And last thing I'm going to say about this, I still wear my mask everywhere unless I know I'm around unvaccinated, or unless I know I'm around fully vaccinated people that I know they're my family, they're kind of like in my bubble. That's because I also don't want mild COVID. I just really don't want mild COVID. I don't want to give it to unvaccinated people, and I don't want mild COVID myself. And so that would be the other piece, is that if you really want to continue protecting yourself from catching even a mild case, continue to wear the mask and continue to do the distancing precautions when you're around people that you don't know, and avoid crowded indoor spaces.
So I have a question that came in, and it says, are the symptoms for the Delta variant the same as they were for the original COVID-19?
That is a great question. And unfortunately, the symptoms are looking a little bit different, and they can be milder. And it's been a little bit hard to parse this out because, as we know, our most vulnerable people, our elders, were the first to get vaccinated. And so now, when we see a lot of the new cases are shifting into a younger age group, and the younger age groups tended to have milder symptoms than the older age group. So that's kind of the caveat before I say what we've been seeing, which is that the Delta variant seems to have less of the more classic symptoms of, the loss of taste and smell, still with a cough, but the cough isn't as big as a presenting symptom as it was with the wild type, the original one, or the main one that we were dealing with. And there seems to be more runny nose and congestion. And so we're just really encouraging anyone who has new symptoms in any of those varieties. So it's congestion, it's runny nose, it's a cough. Don't rely on that loss of taste and smell anymore, because that has become a much less frequent symptom with the Delta variant than it was with the original wild type. So it's really important that we continue with getting tested. If you have symptoms, whether or not you've been vaccinated, if you have symptoms, we really want you to get tested right away. And this is to protect you and to protect others as well. If you're unvaccinated and you get symptoms, we absolutely want you to get tested immediately for the reasons I just said, but also because you may be eligible for treatment that can be life-saving, treatment that you need to get before you're sick enough to go to the hospital. And those are those monoclonal antibody combination treatments. So anyone who gets symptoms should get tested, but especially if you're unvaccinated, if you get symptoms, you should get tested for those reasons. And so, and kind of broaden your thinking around what those symptoms are. You may not have that loss of taste and smell.
Yes. So another question that's come in is from one of the women in our church. She's vaccinated, and her mother, her 84-year-old mother, is also vaccinated. But grandbabies who live in the house are not vaccinated. And of course, they go out and have a good time and play. What advice would you give her?
Yes. So this goes to that, everyone has a little bit of a different, let's say, risk taking, appetite, I guess I'll say. So my advice still is, COVID is not benign in babies. Unfortunately, we do see now they do much better than adults. There is no question about that. But we have seen severe illness in babies and in young children, and even deaths. We also know that there are some things about COVID in children that we don't quite understand. Like, for example, there is an inflammatory condition that happens after COVID. It's called MIS-C, MIS-C, and it's very severe. And over 60% of those babies go to the ICU. And about 65% of those babies are Black and Latino, and we have no idea really why that is or what's going on there. And part of the reason why I bring these things up is because, remember when COVID first started, the word was, oh, it doesn't affect kids. Kids can't get it. And so a lot of the surveillance and the attention, it really went to our older adults. It went to those with chronic conditions, and rightfully so. That is definitely who was being disproportionately impacted. But it took a while for everybody to catch up and realize, wait a minute, this is not benign in children, and something is going on sometimes. A severe inflammatory condition that can affect all the organs and send a baby to the ICU, that's very significant, because with, our children tend to be young, healthy, and bounce back from most of these viruses. And so that is very concerning. We still have a lot to learn there. The other thing I want to say about children is that when children do get COVID, and this is something I like to mention because a lot of people don't know this, when children get COVID, even if they had a mild case, before they go back to their full activities and go back to sports, they need to have a full examination. They need a cardiac evaluation, because it can cause inflammation in the heart that can cause problems. This is getting COVID-19 itself. So I'm saying all that to say COVID in babies and young children is not benign. So we don't want to expose them. We don't want to expose them needlessly. Now, if you're vaccinated, like I mentioned, your chances of catching COVID are much reduced, and your chances of passing it on are also much reduced, but it's still there. There's still that chance. So now it gets to what can you do and what can you not do? Again, for me, I'm going to be a little on the conservative side. So I'm going to say I'm only gathering unmasked with you if you're vaccinated. That's me personally. Now, could you gather with people who are unvaccinated? Maybe you want to do that outside. Maybe you don't want to be in the club in a stuffy indoor space that doesn't have good ventilation with a bunch of people that have no mask on, and you don't know if they're vaccinated or unvaccinated, because maybe your risk of catching it might be around 10-12% in that case. So it kind of depends if you're in that, I want zero risk, I don't want to get it at all, I don't want to pass it on at all, or if you say, you know what, I've been, and this is valid. So this isn't to say that I'm not making any judgments on this. It goes back to your wisdom and your specific circumstances. Maybe you say, you know what, my mental health is wearing on me, I'm isolated, I need to be with people. Let me see how I can do this in the most safe way possible, but understanding that balancing act that we're all having to do. And so I think, what I don't want people to do is to get a false sense of security. Oh, I'm vaccinated, nothing can go wrong. Well, I think you're protected. You did the right thing. Absolutely. Kudos. Beautiful. Wonderful. I'm so glad to hear mom and grandma are vaccinated. That is wonderful. But that doesn't mean we're all the way out of the woods. And I think the other piece is we don't know about, variants. When the next time when the variant pops up, that does break through, we hopefully will get fair advance warning, but there's no guarantees with these things. And so I would just say, keep in your comfort zone and be thinking, what am I exposing myself to? What are my risks? Kind of assessing the situation. How much distancing is there? Is the ventilation good or is it stuffy? Am I outside? Can I go out into the patio where there's good ventilation? Or am I stuck indoors where after an hour or two, we're all breathing the same air? So, just keep those things in mind.
That was the last question I have. Apostle, you have any?
There were a couple on here and I got kicked out, so my sincerest apologies. Did you get the one from Kathy Spearman? You got that one? Okay, so that was answered. And of course, I missed that. What about boosters? Do you think there's going to be a need for boosters? That has come up before.
Yes. So boosters, I think when we've been talking about boosters, we've been talking about two different things. And so I want to kind of separate them out. So the first one is, will we need an actual boost of the vaccine we already got? So we got the vaccine, and then is that going to hold? Is it going to hold, or is it going to wear off and then we're going to need to get a new one? And so right now we only have the length of time that we have to say, but so far it is lasting. The immunity is lasting. Remember, it's not just about the antibodies. So a lot of things you'll see in the press is, oh, the antibodies decrease. Well, where there's a lot of different types of immune responses that our body makes. It's not just only that antibody. So the antibody test is the most reliable thing. I'm really hopeful that there will be some good immunity tests that will be coming out soon. I know they've been working on them. I believe that there was one recently approved. That will be great, right? If we can go do a test and see how our immunity really is holding up. Right now, we don't have a great test. However, for the studies that have been being done with the original trials that were done for the vaccine, the immunity is looking very durable. Even now we're a year out, it is looking very durable. So I don't think that we're feeling like, oh, we're going to need a booster anytime soon. However, what is happening is that this is still an evolving pandemic and we are having mutations. So is it possible that we're going to need a new vaccine against variants in the future? it really depends when we squash this thing. If it keeps going the way it's going, I think that is more possible, that we're going to say, okay, now we went through the Delta, Lambda, Epsilon, and now we need a new vaccine. The good news is, and this is very good news, and I don't know how much, if people really appreciate how good of news this is, the mRNA vaccine is like a platform that allows for like almost a plug and play. When we get a new variant, they can just really pop in that new sequence and voila. And it doesn't have to go through it'll still have to go through trials, but it won't have to go through such a rigorous process, because again, it's like a plug and play, and the manufacturing is the same as the other one, and it will be much easier to deliver it. I know none of us would be excited about having to get a new vaccine. And of course, the hope is that we reach some level of community immunity so that we won't be contending with that. And as I said, so far, so good. So far, vaccines are holding up. We don't need a new vaccine. So will we need another vaccine in the future? It is possible. And it could be that, and we've heard of combination vaccines and recombinant vaccines and different things like that. And sometimes that means that it's kind of accounting for two different strains in the same vaccine. So those things are all possible, but the good thing is they're also within the realm of the technology that has been developed already, and that we should be prepared, at least with better infrastructure, to deliver those vaccines and things like that. So I think we don't know is the real answer. But also just kind of wanting to point out that when we say boosters, sometimes I think we're really talking about two different things in one. And the second one is probably the one I'm most concerned about, because this thing continues to spread and it continues to replicate, and we continue to see new mutations all the time, really.
Have some concerns about taking the vaccination. And so, and I'll let you talk about that in just a moment. But the question came up, should I take Tylenol prior to my first? Don't take Tylenol prior to your first, take Tylenol prior to your second. Take Tylenol after your first. When do they take Tylenol? What do we need to do to prepare for a vaccination?
That's a great question. And, people have such variable responses to the vaccination. Some people feel perfectly fine, never better, no problem. I'm so happy. I feel I feel relaxed, relieved. And then, of course, some people get kind of the expected, anticipated reactions, which, of course, are that arm pain, some chills, fever, kind of body aches, fatigue, those kind of things. And it's hard to predict who's going to be the ones that get more side effects and who don't. So my advice is a couple things. One is I would see, can you do it the day before you have a day off? And that's just simply to relax, just in case you just want to lay around all day. I know I did get side effects, anticipated effects. I was all ready for them. And I was kind of, like, oh, it's working, when I felt, a little bit of chills and a little bit of achiness. And just kind of relax, drink a lot of water, a lot of fluids. You can take Tylenol after, and kind of wait and see how you do is my advice. But some people are very nervous. People are very, very nervous about it, and so you can go ahead and take the Tylenol afterwards if you just want to, prevent feeling some of those anticipated reactions. But really, in just about all cases, it's gone in 2-3 days tops. And so, I would say just kind of plan for it. If you got some of those reactions after the first dose, then, anticipate you'll get them after the second dose as well. Although we've definitely heard people who say the first one was the one that was a doozy and the second one was no problem. It's just been a mixed bag, and it's very hard to predict. So I would say, see, can you have, a day of relax and respite the day after you get the vaccine? Don't plan to be doing anything big, for sure. Try to avoid that. And just, anticipate it, plan for it, drink plenty of water. And yes, you can take, some Tylenol afterwards is fine.
So does it minimize the effectiveness if you take Tylenol before?
Well, there's not really any evidence of that, but, in general, with most things, we try to say, you don't really, if you're not having any issue, then you shouldn't be taking, a pharmaceutical. And, you kind of want to see how you're going to feel, how you're going to do. there's always those concerns about taking something that sort of like it is anti anything before you get a treatment. But there's been no evidence that really points to that it's going to cause a problem. So I'm not worried that it's going to decrease the effectiveness. But I think in general, it's a best practice to, to wait. And especially because you don't want to be taking Tylenol for days on end. And most people don't get the symptoms until maybe like 24 hours afterwards. So starting 24 hours ahead of time, it just seems like, unnecessary. And I know there's concerns about that, but probably no real direct, evidence around that.
That's good. I think we need to prepare ourselves as best as possible. And as you're speaking of this, I really appreciate it. I know for me, I'll just give an example. You hear there's so much buzz about who had symptoms, who didn't, what the symptoms were, what the effects were, until I looked for symptoms. I looked for, and I finally told someone, enough is enough. I'm going to stop looking for it. I'm just going to live, right? And so I think that, should it happen, we know what to do. We understand it could happen, but don't make yourself a nervous wreck and be anxious and worried or fearful, and none of this that we're discussing today is to make you fearful. Where our goal is to relieve you from any fear, any worry, and to give you wisdom. But I want you to be very mindful. Everyone reacts differently. And so just know your body, know what the symptoms could possibly be, or the reactions could possibly be, and just use wisdom. But don't live in a place of fear and anxiety. Is this it? Is the arm hurting? I got a little twitch, got a little headache. Don't do that to yourself. Don't do that.
Absolutely.
Dr. Aboelata, is there anything else you would like to share? I mean, I've listened to your YouTube, your health briefings, and I wish I had known about this sooner. So I really appreciate the work that you're doing and the information that you're releasing. You mentioned this, and then I broke up quite a bit, but you mentioned about the myocardia, and that was a concern because we're raising our 13-year-old granddaughter, and she wants to be vaccinated. She needs to be vaccinated because she really wants to be around her friends, go to her cousins. There's many, she's 13. They've been shut in for so long, and so she had her first vaccination, and so she's getting ready to have her second next week. But I monitored her very, very closely. I watched just to make sure, how are you doing? You have to check to see if there was a temp, fever, what about the heart? I want to make sure everything is in order. I know you mentioned that COVID could cause that, but the vaccine could also do that. However, when I read something, an article, that it was so minimal, it was like 257 or something like that cases out of the thousands and hundreds of thousands of people that have been vaccinated. What's your thought on that?
Yes, it's a great question. And of course, anytime, that there's anything that we are administering to children in particular, we want to just be very, very vigilant and very careful. And there were those cases. They had first detected those in Israel, and then here. It is a small number, as you say. And so, so I think that it's been very clear that, first of all, COVID itself can cause myocarditis. And so we know that that's the case. And a lot of, myocarditis is not a common thing, but it's also not a new thing. And oftentimes when people do get myocarditis, it is after a viral illness. And it can even be after certain vaccines. And so this isn't sort of out of the realm of anything. It's not something big and shocking, but at the same time, it's something we do want to be vigilant and be watching. And so all of the bodies that are overseeing the vaccine and the vaccine safety have taken this very seriously. They have been monitoring all of this data, and it is a small number. The majority are in boys. And so we just want people to be on alert. And as you say, you did exactly what we would suggest you do, which is after a young person gets a vaccine, I really recommend have them take it easy. There's no reason to go exerting yourself. Just take it easy for a few days, keep an eye on them. The signs and the symptoms are chest pain, shortness of breath. It could be like a rapid heartbeat. And as you say, it's such a small number that you almost hate to, it's like the drug commercials where you have to say all the different things that could go wrong, and it can feel overwhelming and scary. But it's just because we want you to be vigilant and informed. But we know that the risks of a poor outcome from COVID itself far exceed anything that we've seen from the vaccine. And as you say, after hundreds of thousands of doses have been administered to young people. And so we still, the guidance is still that the vaccine is the best way to go. But, I would add sort of that caveat of, keep an eye, ask, how they're feeling, how they're doing. And yeah, don't have them run a marathon the day after the vaccine. Let's have them, kind of relax and not do any big exertion for several days after they get the vaccine. And also it was more common after the second dose. So all of the things I said, would be even more so after the second dose.
Okay. All right. That's good. Brendetta, I'm not sure. I have a question, but I'm not sure if it's really a question or if this is a statement. So be clear for me, Brendetta, and let us know.
I have her question.
Okay.
She wants to know if you're on getting a 2-dose regimen and you miss the second dose, how covered are you from the first one? And when you go to do the second one, do you need to start the whole thing over again, meaning get the first one again and then do the second one?
That's a great question. So the first dose, it was looking pretty good protection wise for the wild type, but with the Delta, it's not enough. We really want you to get that second dose, and you can get it at any time now. And there's no reason to start over. So you'll get it. It's almost like a boost itself of the first dose. And so go ahead and get it. You don't need to start over. But please do go ahead and get it. And I think I feel more urgent about that now than ever, because it's looking like after that first dose, with the mRNA vaccines, it's not covering the Delta the way it covered against the wild type. And you just really need that second dose to get up close into that 90% range. So while we don't want people to wait past that period, there's been enough evidence to show that that second one is giving you a boost, even if you waited a little bit too long. But I wouldn't delay any further. I mean, there's no time like the present.
Awesome. I don't have any other questions. Pastor Michelle, do you?
I do.
Okay.
I've heard from professionals in biotech that they're ready to get vaccinated, but then like the hesitancy seems to come more from nursing professionals. What is your thoughts about that? What are your thoughts about that?
About why there's nursing professionals with hesitancy?
Yes.
It's a great question. I wish I knew the whole answer, but I can tell you a little bit of what I have discovered, because I've been asking everybody what, where people are coming from and what people are thinking. And I think part of it has to do with, I think it's important for everyone to understand what healthcare professionals have been through in the last year and a half. It has been, I mean, I've experienced every emotion as a healthcare person, things that I don't think I would have expected, as being US trained physician, of the thought that we would not have masks to protect ourselves. Because you remember, we lost healthcare professionals, we lost nurses, we lost doctors in the beginning of this crisis because we didn't have enough protective gear. And the idea of that, I mean, if you would have told me that 2 years ago, that something like that could happen, that the United States wouldn't have enough masks for doctors and nurses, I would have said, that's crazy, right? But that's what happened. And so there was a lot of trauma that I think healthcare professionals went through in this, and a lot of demoralization, then followed by those who survived, those of us who, went through this. How do we protect ourselves? How do we protect our families? Extreme vigilance. And so you see, when you go into healthcare spaces, and you're going to see N95s, face shields, sometimes those big old, head to toe PPE. Our frontline staff all know how to protect themselves and their families. And for a lot of people, what I'm hearing now is, I know how to protect myself. I've gotten through the worst of it, and I know how to protect myself. And it is discouraging and concerning because, you know, that is who we look to oftentimes about this. And so when they say, and I'll tell you, you know, myself as a physician, I am one of those physicians that does not jump on bandwagons. So if you come out with a new blood pressure drug, you know, I'm going to use the old stuff until it's been out for a year or two so I can feel comfortable. And I wish we were in that kind of situation where I could just wait a year, but we are not in that kind of situation. We do not have that luxury, and this thing will still kill you regardless. And the problem is we don't know who it's going to take out. And unfortunately, people have died of COVID who we thought should do fine. And so I really think it's unfortunate, you know, that we're seeing some folks in healthcare who are having a bit of resistance. But I do think part of that has come through, you all don't understand. I've been through the worst of it. I know how to protect myself. I'm not getting this thing. I'm not catching this thing. So they're relying on all of the protective measures they've taken all this time. And again, this is no judgment on that, you know, on that opinion or on that feeling. If they're truly protecting themselves, you know, so if they're doing that at work and in their private life, if they're doing all those things to protect themselves, then again, they're doing their own risk benefit calculation and that's what they're coming up with. I think the challenge and the concern I have is right now society is letting down their guard. And so we can't rely on these things anymore. I really don't think we're in a position anymore where we can rely on those things. And so I do hope that all of those people, whatever field they're in, are taking this seriously. And if they're waiting for something, most all of them will tell you, I'm just waiting. I'm just waiting a little while. They're not saying I'm absolutely not getting it. I'm very few in healthcare have I heard say I'm never getting it, right? It's more that sort of like, I want to wait and see. And what I would say to that, what are you waiting for? What are you waiting for? I don't want you to wait until you're laid up in the hospital because then it's too late. I don't want you to wait until someone in your family dies of COVID and then you say, oh my God, this is serious. So what is it that you're waiting for? And hold yourself to it. And I'll just share really quickly. I waited, okay? I waited maybe about 2 months after I could have gotten it. And what I was waiting for, I said, I'm waiting for 3 million doses. I want 3 million doses, you know, so I can see that 1 in a million. That was my benchmark, right? It might not be totally scientific, but that's what made me feel comfortable. So I still did all my vigilance, you know, where my N95 did all of that. And then after the 3 million doses, and I said, wow, this thing is safe. It's effective. It's saving lives. You see cases coming down. Some things that were very profound to me that happened is all of the tragedies that were happening with our elders in the skilled nursing facilities. It came to a halt. Those deaths, it came to a halt. I mean, very astounding to see anything that effective, right? And so those were the things for me that was like, okay, I've got the evidence I need. I'm just going to take some deep breaths over, you know, I mean, we all had, you know, it would be abnormal not to have experienced fear or anxiety during this time. This is new. This is like the stuff of movies, right? This is the first time we've been through something like this. So we should all give ourselves grace. Like we're going to have, you know, I remember coming up to the thing, I'm about to get this. Okay. I'm going to do this. Okay. Take a few deep breaths. That's okay. You know, it's okay not to be that person like rushing up to the front of the line. I'm ready to get it. That's okay to not be in that boat. If you've waited long enough. Okay, it's been out for a long time. So if there's something you're waiting to see, I'm really asking this question. What are you waiting for? What is it that you're waiting for? We have so much data. It's unbelievable. Believe me, you have probably taken a medication or consumed something that had far less data on it and a far worse safety profile on it, right? I'm just saying, this is just something that's under the microscope and everybody's looking at it. When you put it into perspective, we have a lot of data and it is pretty, it's reassuring in that sense. Is it perfect? Of course not. There is nothing on this earth that is perfect. But the data is very clear around your chances of doing poorly if you catch COVID. You know, they still remain concerning. 1 in 20 go to the hospital with COVID. I mean, 1 in 20, that's quite the gamble. So you really are kind of playing a little bit of that Russian roulette. I mean, I hate to say it, but that you really are taking a gamble. You are absolutely continuing to take a gamble if you are unvaccinated. You can go to the hospital. You can go to the ICU. You can die with COVID. People are still dying today. People have died from COVID today here, you know, in the Bay Area, in the state, in the country. So if you're waiting for something, please tell me what it is or tell yourself what it is and hold yourself to that, because by any measure of the amount of data you need to make a decision, that day has passed already. So what is it that you're waiting for? Because I think a lot of it, to kind of circle back to your question, a lot of it is the natural fear that we all have, and a belief that I can protect myself from this. I'm not going to be susceptible. And that may be true up to a point, but are you going to continue to shelter in place for the rest of your life, or for years? Are you going to continue not to be around other people who are unvaccinated, or excuse me, who are vaccinated? Are you going to continue to do all those things? Or are you just throwing caution to the wind and deciding to gamble? I mean, if that's what you're doing, I'm really concerned about you. So I think we just all need to be very honest with ourselves. I think that's what a lot of this is about, is be honest with ourselves, and what is our ability to really continue to follow all of those precautions, because that's what you need to be doing. You need not to be convincing yourself that cases are so low, I don't need to worry anymore. No, you do, because it only takes one exposure, and they're happening every day. We run a testing site. We have positives every day, and we have sad stories all the time. And we don't want any more of them. We don't, because now when we hear about someone dying of COVID, it's even more heartbreaking, because this is now a vaccine preventable illness. This is a vaccine preventable illness, and it is considered unacceptable to die from a vaccine preventable illness. If you think about it, if someone died of tetanus, what would we say? Oh my God, why didn't they get the vaccine? That's crazy, right? Someone dies of measles. Well, why didn't they get the MMR like everybody else did? COVID has now entered the category of vaccine preventable illness. So to hear someone now dying of it, we should all feel heartbroken about that, no matter what, but because we could have done something to prevent it. So, I would say, if you feel like you're waiting for something, what is it, and hold yourself to that, please.
This is really good. You said something which was exactly, I just got a message from my nephew that my great nephew has COVID. He was just tested and he got it. I just received the message. So I want you all to pray for my great nephew, who's my nephew's son that passed a couple years ago. But Dr. Aboelata, you said something, which is what I said. One of the things I said is that I felt like I wasn't getting it, and I was waiting, didn't really know what I was waiting for, and I was waiting. I don't know if I was waiting for herd immunity, because I hear that quite often. But I waited, and then I thought, but whatever you do without faith is sin. So I needed to make sure that I believed in what I was doing, and I didn't. And the reason I didn't is because I felt as though I was playing Russian roulette with my life and my husband's life. So I used those exact words, and I shared those with some of my colleagues. I felt as though I was playing Russian roulette. And that's, you don't know who, you don't know what. My husband had been ill, and so his family wanted to come and see him. And they've come from New York and Mississippi and all over. And I did not want to play Russian roulette any longer. And so that's what did it for me. We're not, trying to impose our feelings on anyone. I just want you to know this is serious. I had a question that came through that says, even though I'm covering myself up, and you may have seen this, Pastor Michelle, I can't get back to it because I keep freezing. But even though I'm really protecting myself and I'm covering myself up and I'm doing everything that I'm supposed to do, should I still get the vaccine? And according to your answer, what you've been saying is yes. Is that right?
If you are, here's the thing. There's two answers. One's the individual answer. One's the are we going to get to community immunity? And we need everyone to be, to be hopefully part of the solution if we can. If you are truly sequestering yourself and you're not going around literally anybody, then, then you're not exposing yourself literally ever. But I just find it very hard to imagine that anyone could really do that. And because anytime you're in an enclosed space, like I mentioned, if after an hour or so, everybody's breathing the same air essentially. So even if you have a mask on, at some point the air fills up, and if someone had COVID, then, you're going to, unless you're wearing a properly fit tested N95, which is the only mask that is going to filter your air. They're very uncomfortable. It's very difficult to wear it all day. you know, and it's kind of impractical. So I think it's probably not practical, and it does start to wear on your mental health if you are literally isolating yourself away from everybody all the time and never, ever, ever exposing yourself. And I really have not met too many people who are actually doing that, who actually can do that. And then, you know, I think, so I don't think it's sustainable for one thing. And I think what people think of as protecting themselves, again, you know, what I'm saying is protecting yourself is what we do in the hospital. That is protecting yourself. What we do in the clinic, that is protecting yourself. You are wearing a properly fitted N95 and an eye shield. So you're doing the whole coverage. And that is protecting yourself. And then of course, all the sterile precautions, washing your hands, all those kind of things. And I just don't think the average person does that. And I don't think it, you know, I don't think it's sustainable to do that. But I think the other piece of it is, you know, we do have to get to a threshold to reach that community immunity. And that means enough people being protected with the vaccine so it can't keep skipping from the next person to the next person. We have to break the chain. And we're not there yet. And so, you know, we still have a ways to go. So of course we want as many people who are eligible and who can to be part of that equation as well. So I think it's a two-part consideration. You know, from the individual perspective and from the population perspective. But I have not yet really met anyone who could sustain that level of protecting yourself and, you know, and being isolated. And also we get concerned if people are too isolated. And so I think that's also a very real thing to be considering as well. You know, the day I got to hug my mom after a year of not being able to do it, you know, that carried me, you know, that's carried me now to where it's like, you know, step by step, we can reintroduce things step by step. We don't have to do it all at once. But once you're protected, it is a big feeling of relief. I mean, I was surprised actually at how, you know, because I've been very, very diligent about my mask and all that stuff. And I don't feel like I did anything wildly different in my behavior than I was doing before, but the feeling of a bit of relief, like I'm protected in a way that I was not before. That is hard to almost articulate and to quantify, that a little bit of more peaceful feeling. But I think that is also worth considering, you know, that feeling of not feeling like you have to be as hyper vigilant every moment of the day, all the time. There's real value, I think, in that as well.
You know, you keep saying something that is stirring me, and that is even with the mask on, and you're in a room with people for long periods of time, ultimately you're going to breathe the same air. What's that long period of time? What does that look like? Are we talking an hour? Are we talking 2 hours? Are we saying 6 hours? What is that length of time?
Yeah, unfortunately, this turns out to be a very complicated equation. So I've had to dabble in a little bit of mechanical engineering to understand all of this. But it depends on a number of factors. And the main one being, what is the ventilation? And so it's hard to know how well ventilated a place is when you go in it. Sometimes you can feel it. You can see, oh, all the doors and windows are open and there's air moving through here. And we know we have good ventilation. Then the time becomes longer. If it's stuffy in there, then the time becomes shorter. And so it's actually a calculation that gets done based on the size of the room and based on the air exchange. Now, air exchange can be from windows and doors being open, and it can also be from your HVAC system. And HVAC systems, you know, you have to know how often it is exchanging the air. And so most homes do not have adequate, you know, HVAC systems that exchange the air at the rate that you would need to clear out COVID. And some businesses do, and some businesses don't. And it's very hard to know which is which. And so all of us who are, who run businesses or who have buildings, we should be having the people who specialize in this take a look. Is the ventilation appropriate for this room size? How often is the air being exchanged? That's going to help determine what is your occupancy, right? And so when you're inside, it's not as much about how many feet distance, it's how many people are in a space and how good is the air exchange. So these things tend to be a little bit difficult, unfortunately, to kind of like do all this math, right? The other piece is, once the air is exchanged, if it's recirculating, is it being filtered? And so if you have an HVAC, if you're relying on an HVAC system, it has to have a proper filter. And so you have to have, you know, either a HEPA filter or a MERV 13 filter or higher. Someone has to make sure it's fitting properly, just like your mask has to fit properly. It's a filter, right? So if air just goes right around it, it's not being filtered. So there's a number of factors around this. I sort of, like to assume that, in most spaces, unless you have reason to believe otherwise, once you start getting over about an hour time, you're starting to have a lot of air mixing. And so even if you've got that, unless you've got the N95 on, the air is going to start filling up. So even a person across the room, they're breathing over time, the air fills up. And so it's just hard to know. There are some people that are advocating for CO2 monitors to be in your indoor space to give you CO2, builds up in a space that's not well ventilated. And so it kind of is like a proxy or like an approximation. It's not perfect, but it is one way to kind of try to see if you're getting good air exchange. But this is something that really professionals have to do. And so that's why I say in general, we should be avoiding crowded indoor spaces, period, unless we know everybody in there is vaccinated. Short of that, keep it outdoors, or keep it with people that and that are sort of, that are vaccinated, or otherwise you're going to be breathing the same air. You're going to be sharing air. And I should mention the car, because we've seen a lot of little outbreaks happening in carpools. So, if you COVID doesn't get off at 5. I say that's you get in the car after, keep the mask on, roll the windows down. Even a little bit of cracking the window is going to give you some air circulation. But if you're riding in the car with someone and you don't know their vaccination status, keep your mask on, again, preferably an N95, or you wouldn't be in the car with them. You have just gotten in a bubble with somebody. That space is going to fill up in, probably, I don't know, half hour, an hour. Again, it just depends. Roll down the windows. Now you've really improved the situation quite considerably. So just be mindful of being in an enclosed space with someone whose status you don't know, because, I know everybody probably knows this, but that first, few days of when you're contagious is before you get symptoms. Right. So this is one of the things that I hate the most about COVID. It's just like, why can't you be like the other viruses that everybody has symptoms? And you get like the flu, you generally, when you're contagious is when you have symptoms. COVID is not like that. You have days of not having symptoms while you're contagious. So you don't know who has it. So if you don't know, if someone's not vaccinated, I still assume they've got COVID. I've been assuming everybody has COVID since the beginning of the pandemic, because you don't have a way to know. So unless I know you and I know that you've been careful, I know you've been vaccinated, then I'm just going to assume I'm in a space with someone who has COVID, so I should act accordingly. And that's honestly what I do.
I think that's great, because you're right. It's silent for the first few days. What about airplanes? We talked about cars. What about airplanes?
Okay, so I'm a conservative again. I'm a little conservative on COVID, right? So you are in an enclosed space in the airplanes, and it does appear that airplanes have pretty good air circulation. So they've definitely, upped their game. There is a little bit of a concern that perhaps the onboarding and offboarding process, how they powered down that the air may not be circulating at that time. So that's a little time of concern for me, that I don't feel I have enough information to know, is air circulating at the boarding and the offboarding times. Remember that even with great circulation, if the person sitting right next to you has COVID and they sneeze in your face, you get COVID. And so, you're still going to want to, it doesn't matter how good the ventilation is, because the air goes by you to get out. And that's one of the things that I was mentioning about the professionals. One of the things they look at is the direction and the airflow. So you don't want, if you have a positive COVID person here and your air filtration is over here, and the air is being pulled across, and you're being pulled across 5 people, those are 5 people that can get exposed to COVID. And so that's really the concern, is that it really depends how close you are to people. We know people have gotten COVID on airplanes. There's been enough case studies of that and enough examples of that. I think that a shorter flight is always going to be safer. If I had to go on an airplane right now, which I'm not probably going to be comfortable doing that anytime soon. Again, that's my own comfort level. I would be wearing an N95 and an eye shield, and I would not eat or drink on the plane. And especially if everybody is getting ready to eat and drink on the plane, that's when you want to keep your stuff on because that's when everybody is taking it off and they're breathing. And, so we know talking, singing, breathing, eating, all those things that require the mask to be on and activity happening with your mouth, that's when COVID gets out. And remember, we are now dealing with a strain that it looks like it's about twice as contagious as the original one. So all the stuff you heard, from back before, just double that intensity. And that, it's almost hard to imagine something being more contagious than the COVID we've been living with, but it is. So I still say, be very, very cautious if you do need to travel. It should be, to me, it should be, really consider your risk, consider who you're going to go visit. Are they vaccinated or not? You don't want to bring somebody COVID. So you may, so again, I think if you're vaccinated and you take proper precautions on the flight, I think that, you can do okay. The airports are crowded indoor spaces, right? So again, minimizing your time having to be in there, washing your hands, being careful about all of the different surfaces you're touching, because even though we know surface transmission is probably the lowest likelihood way that people get it, it's still a way that people get it. And when you have a lot of high touch surfaces, like in an airport, everything is like a high touch surface. In the airplane, everything's a high touch surface. You're really going to want to be washing your hands, sanitizing, and not touching your face, which again, the mask is a great way to keep you from touching your mouth and nose too, because that's the other thing that was great about the mask, is not only sort of just, protecting you from spraying droplets on other people, but it reminds you not to touch your mouth as well, which is a way that things do get spread in general.
This has been wonderful. I really thank you. I want you to have last comments, but I want to ask one last thing. One of our members who has, they said she has first stage cancer, although it's all been removed. And she texted me personally and said, please ask, should she get, everything's done. About 3 weeks ago, she's had surgery. She's home recovering. She wants to know, should she get vaccinated?
Beautiful. I'm very glad to hear that it is resolved successfully.
Yes.
So I'll say that it sounds to me, just based on the limited information, that she would be a perfect, ideal person to get the vaccine, because we don't want her to get COVID, right? We know that people who've been through surgeries and through other things, we want to protect them. Certainly. We always want anyone who's undergoing different types of treatment to please check in with your physician. Normally what it is, I will say, for both cancer as well as anyone on immune suppressing medications, which sometimes those are what cancer can do. If you're undergoing, let's say, chemotherapy, you're undergoing a high dose steroid. I'm not talking about a steroid inhaler or a steroid cream or anything. I'm talking about very high dose steroids that are meant to suppress your immune system, maybe from an autoimmune disease, some autoimmune drugs in particular. What happens with those is that if you're in a course of treatment on those, you may not mount a good response to the vaccine. So it's not that the vaccine will harm you, it's that you won't get the response we need you to get from the vaccine. So as a result of that, and there's a lot of guidance for especially rheumatologists and oncologists and doctors who are treating these conditions, they will figure out the best timing to make sure that you get the vaccine at a time when you're likely to mount the best response. So they might time it where you finish this cycle, then we're going to do the vaccine here, then you do this cycle, for example. So in this case, it sounds like the person you're asking me about is not in that situation. Never hurts to just check in with your doctor and say, is it fine for me to get the vaccine? From what it sounds like, definitely it's going to be a yes, please, because normally those are the folks we want like at the front of the line, right? Because those are the people that we're worried are going to do poorly if they catch COVID. But I did want to bring that little piece up about the consideration of timing of the vaccine so that you mount the best response. So certainly if you're on any of those kind of medications, that's when we want you to certainly check in with most likely it's going to be with your specialist. You can start with your primary care doctor, but likely will be with your specialist because they've got these kind of regimens figured out about how to maximize your response to the vaccine.
Okay, and the questions keep coming, so we're going to have to cut it in.
Can I ask the second half of one question you asked earlier, but there was a part of it you missed. The person wanted to know if they're unvaccinated, what percentage and they're wiping everything down and everything, what percentage at risk are they of getting COVID?
Okay.
So if you're unvaccinated, it's back to that Russian roulette, right? This depends on how much you're exposed. It only takes one time to get exposed, and it is so contagious that really, we know that it doesn't take long. You could be just within 6 feet of someone that has it. They could be 20 feet away and sneeze and you could get, I mean, literally, this is how contagious this thing is. You could be in the room with them, as I mentioned, even with a mask on, and over a period of time, it's still possible that you catch it. So if you're unvaccinated, this is a highly, highly, highly contagious virus. And so if you're exposed to it, your chances of catching it are incredibly high. And they are reduced by about 95% if you get vaccinated. So, I mean, it's really night and day. I think you are just risking it. You're taking a gamble, right? Because you don't know who has it or not. And so your chances of getting it today might be, with the same activity, maybe less than in the winter when we were surging and there was a high number of cases. However, having said that, in the winter, everybody was required to wear a mask. Everybody was required to do distancing. That's not required anymore. So you no longer can rely on the protections that were put in place. Those are gone. And part of the reason why that concerned me is because now everyone's just going to act like it's over when it's not. And if you're unvaccinated, in that sense, if you are unvaccinated, I am more worried about you now because we got more contagious strains. We've got at least one strain that does look to be more virulent, so it can get you even sicker than the original variety. And everyone's not doing precautions for you anymore, right? It's all about, I mean, in some ways, it does kind of irritate me a little bit because I feel like it's very much individual. Okay, well, I'm vaccinated, I'm fine, I don't have to worry about it anymore. Well, what about all the people that are still unvaccinated? What about all the children who are out there who can't get the vaccine? What about all the adults who haven't had a chance to go get it or still, so I think in a way it was meant to push people to getting it, which, it just concerns me in that sense because I think it's sending a wrong signal. So, it's very much a gamble, if you are unvaccinated and if you get exposed, as I said, the risk of going to the hospital is about 1 in 20. The risk of death is about 1 in 56. And I don't like those numbers at all. And those numbers, frankly, our treatment hasn't gotten that much better through this thing. We don't have a cure, so that's unfortunate. It'd be great if we just had a cure and we knew if you got it, you could just get a cure. We don't. There are people still going on ventilators. There are people still spending a month in the ICU. It has improved. I'm not saying it hasn't improved at all, but as you know, we have no cure. We have things that don't work that great a lot of the time. That's what we have right now. We don't have that. So with those numbers, and those numbers, may be changing as we go on, as more elders get vaccinated and so on. But those have been average numbers for most of the pandemic. 1 in 56 die, 1 in 20 go to the hospital. So I think that's the answer to the question.
You have just shared a wealth of information, and I know that everyone who has tuned in has been tremendously blessed. I want to ask, are there any other closing remarks? Is there anything else that you think we need to know?
I think this has been a really challenging time for so many reasons. But right now, I think one of the things that we are battling against a little bit is, disinformation and misinformation just being put out there and really kind of playing on and preying on the fears of people. And I think that's very wrong. And it's very concerning to me how much just blatant, manipulation is going on out there, and how it's really, people are profiting off of that. People are really monetizing that misinformation and disinformation and the clicks and all those things. And so I say that to say, the truth and it seems harder sometimes to find these days than the lie. And so I think what you're doing this evening is really important, is just having those conversations, getting the questions answered so people can get, credible information. And we all need people that, I have people who I want to know what they're saying about it. I hope we all have, people who are experts that we can rely on. People who really, this is their field of study. So, we're seeing people pretending to be doctors. We're seeing all these things on the internet and around, and it becomes very difficult to know what to believe. It really is incumbent upon us to really hone our skills and really use our wisdom and not fall victim or prey to what really seems to be, I've never seen anything like this before, of these disinformation campaigns happening. They are really, they have quite a bit of momentum. And so I think it's really incumbent upon all of us to not share those things and spread those things and give them more legs and momentum than they already have, but instead to really seek the truth, seek people that you can trust, that you can really get your questions answered. We all should have a primary care doctor. If you don't have one, please get a primary care doctor. Hopefully you have one that you trust. If you don't, find one that you trust. You deserve to have a primary care doctor who you want to listen to and want to trust. So we all deserve access to good information, and it can be confusing out there. So let's all do our due diligence. Let's don't just, let down our guard and pretend everything is back to normal, so to speak, because it certainly is not. And we need to have all the tools, all the knowledge. We deserve the best tools and the best knowledge. So do what you can to seek those things, and don't rest until we're through this, and until you are protected and those that you care about. And that means really seeing through to the end of this pandemic. And we just are not quite there yet.
Well, again, thank you so much. This has been great. What I'd like you to do, Pastor Michelle, if you could put a link up for Dr. I just feel like I'm going to mispronounce your name.
You've been getting it right every time so far, but everyone calls me Dr. Noha, so that's fine too, but it's Aboelata.
Yes, Dr. Noha, Pastor Michelle, put the link up to her health briefings. I would really appreciate that. I would like for us to tune in. You said that's once a week. It's Tuesdays or Wednesdays?
Every Tuesday morning at 10. Yes, it's on Facebook Live and on YouTube as well.
Wonderful. I want you all to really go in and listen to those messages. I've listened to it many, and I've been tremendously blessed. Again, Doctor, we appreciate you so much, Dr. Noha, for taking of your time and sharing with us and giving us this wisdom tonight regarding our health. I know there's so many questions, but we'll be here all night long. Perhaps they could send you a message on Facebook or something.
Please and then do. They can be sent by, yes, absolutely, direct message on Facebook, or our email is admin@rootsclinic.org. And we do respond to those questions, and we even sometimes will do a briefing on the topic. So admin@rootsclinic.org is another way, or direct message on Facebook.
Fantastic. My husband, this is kind of off topic, but my husband has 2 daughters that graduated from Howard as well. Beautiful. And I don't know, do you know any chesses? There were chesses then.
I don't, but medical school, we had our head down like this. Yeah. I didn't have as much fun as the undergrad.
Well, God bless you again. We thank you for your time, and you'll be hearing from us again in the near future, but we appreciate it. Everyone, I'm getting so many messages just saying thank you. We appreciate it. Wealth of information. This was good for us. We needed this. So again, thank you for your time.
Thank you so much for having me.
God bless you.
Thank you.
All right. Wonderful. Okay, everyone. Next week, we're going to look at mortgages and what's happening today in the land. We're going to look at that. We're going to look at, there it is. She has it up there with Cash Benham. I want you to come and be a part of that plan, buy, borrow, and invest. Real estate, everything you need to know about real estate, he will be on with us, and it is going to be a tremendous blessing. The 21st, estate planning, leaving with love. I like that. And attorney Delonda K. Coleman, you need to be notified of these things. You need to be aware. You need to be abreast of these things. And then we have a wonderful young man, Michael Ching. He is the owner of Nardine Wealth Management. And he is fabulous. I spoke with him, and he has a wealth of information, and he wants to teach you now, no matter what age you are, teach you now how to be successful. And so we believe God, and we thank the Lord. I started out with the scripture. I want you to write this down, Psalm 112 and verse number 5. And it says, a good man showeth favor and lendeth. He will guide his affairs with discretion. And this word discretion means with knowledge. When you have knowledge, you can make the right decisions and the right choices. And so we want you to have knowledge, people of God. We don't want you to be so heavenly bound that you're no earthly good. We need to be well-rounded men and women of God. So I bless you. We want to sow seed on tonight. Lift those devices up, and we're going to sow seed. and we're going to be a blessing in this ministry that's being a blessing in your life. Amen. Thank you, Pastor Michelle. In the morning, sow thy seed. In the evening, hold not back. For we know not which will prosper, this, that, or whether they both might be alike good. I thank you. I was so helped tonight, and I'm sowing my seed. But I want you to sow seed, and we want to be continue to be a blessing to each and every one of you. Sow your seed. If you haven't tithed, pay your tithing. You don't have to wait until Sunday. Days for waiting till Sunday are over. You can pay it now. Get it out your pocket. Get it out your bank account so that you don't spend it. Pay the tithing and bring the Lord an offering. I'm going to be talking about Friday at our 6 a.m. same grace anointing. There's a same grace. The grace that is upon the one, the ministry, or the person that you sow into, that grace you partake in when you sow into that ministry. All right. I want you all to be blessed. The hour's late. God bless you. Thank you for joining in. Next week, tell everyone that you know, whatever you thought you knew about mortgages, I want you to just come to the table and we're going to ask questions. Ask your questions once again, and we'll get as much information as we possibly can. Some of you are looking at reverse mortgages. What should I do right now? What's happening in the market? What's the shift? A lot of things are happening, and I want you to be abreast of all of these on next week. Amen. God bless you all. Father, I thank you. We thank you for the word tonight. We thank you for Dr. Aboelata. We thank you, Father, that a good man shows favor and lends, and that he guides his affairs with discretion. We thank you that these have the wisdom to guide their affairs and to handle their business with discretion. So I bless every son and daughter on the line, and I give you the glory, the honor, and praise in Jesus' name. Amen. Amen. Be blessed, everybody.